lift our voice and sing to you. Lift our voice and sing to our King. My soul longs to
That what you're saying?
voices loud. We've come to sing it out. Nobody like you. Nobody like you. Voices loud. We've come to sing it out. Nobody.
Hola y está en Verizon. Una red.
Spectrum Mobile is the fastest growing mobile provider in the nation. And now is the time to switch. Get Spectrum.
All righty. That was fun. All right. We are going to get started. We have 1 minute remaining, and then we are going to get going. We are going to go over the Comfrey tonight. And this is a very, very good one. Very good. I'm going to wait just 1 or 2 more minutes here because we got some more people hopefully showing up. And if not, we're just going to take it on because at 7:30 we got Brother Jackson supposed to be coming in. We're going to have a prayer service. So time is, as always, the essence. Time means everything. So don't waste your time, right? Make sure that you're doing the best and the most of your life and your time because you only got one time, one life to live. And that we will all stand and be judged for. So with all that being said, it is 7 p.m. And according to everything that we know, we are on. So let's go. This is a shrub that grows in parts of Europe, Asia, North America, and it can grow up to 5 feet tall. It produces clusters of purple, blue, and white flowers, and it's famous for its long, slender leaves and black skin roots. The root and leaves of the comfrey plant have been used in traditional medicine in many parts of the world. In Japan, the plant has been harvested and used as a traditional treatment for over 2,000 years. It was originally called knit bone, and people used it to treat muscle sprains, bruises, burns, joint inflammation. Now, what we also have to understand is this is a very, very important thing for wounds. It treated wounds and bones and a cellular level, which is very, very important. So if you have a deep wound that may have cut the bone or broken bone, you see on movies mainly that these bones go through the side of a leg or something like that. That usually doesn't happen as we know and as most of us have seen. But if it does, this is the perfect thing for that. This treats the bone breakage and it treats the wound. And we know people going in to have surgeries and having things done. So this is one of the main things that you should be using. Europeans have also used comfrey to treat inflammation conditions such as arthritis and gout. Some traditional healers have also used it to treat diarrhea and other stomach ailments. The roots of leaves in the comfrey plant contain chemical substances called allicin and rosmarinic acid. Allicin boosts the growth of new skin cells, while rosmarinic acid helps relieve pain and inflammation. Extracts are still made from the roots and leaves and turned into ointments, creams, or salves. These solutions typically have a comfrey content of 5 to 20%. While comfrey is well known for its health benefits, it also poses some risk. It contains compounds that can harm your liver. It may also be carcinogenic. As a result, many countries have banned the sale of oral comfrey preparations. Many experts also advise against using the topical comfrey on open wounds. Now, again, with this and all things, you must do your research. And to a lot of people's findings, they scare you to death, just like everybody else. You go to a doctor, you go somewhere, and they scare you to death. Don't take that, that may kill you. But what's the alternative, right? The ending's the same anyway, right? But what's the point? The point is that you have something and the knowledge of something that can help heal your body and your wounds. And it doesn't leave long-lasting effects, and it doesn't hurt your whole entire body. So, comfrey is a remedy. People still use comfrey as an alternative remedy for joint and muscle pain, as well as closed wounds. It's available at many health stores and pharmacies. What is it used for? What can we get it in? Ointments, creams, other topical solutions, salves that also contain other herbs, such as aloe and golden seal. Some clinical research supports the claim that comfrey has wound healing powers. For example, a research review published in the journal complementary therapies and medicine found some evidence that Comfrey can help heal abrasion wounds. The authors note the topical applications of Comfrey appear to be safe, but more research is necessary to learn about the potential risk and side effects using Comfrey on your skin and wounds. Joint pain, according to the same research review, results also suggested that Comfrey can help treat osteoporosis, right? As well as some injuries such as ankle sprains. A study reported in another research also suggests that the creams containing Comfrey root can help relieve upper and lower back pain. So it'd be interesting if these creams that has that carcinogenic warning on them or not. Just thinking out loud. Check your vitamin levels and take your test, right? That's what we need to do. We need to make sure that we are where we need to be. And we need to do it before it's too late, before we feel sickness and before we have problems, right? That's what most of this is about. But this one in particular is an after wound healing. We just can't help certain things happening. Can't help surgeries. We can't help cuts. We can't help wrecks. We can't help a lot of things that happen. So with all that being said, we need something to help us heal better. Historically, some people have eaten Comfrey leaves as a vegetable. Traditional healers have also used oral preparations of Comfrey to treat stomach issues such as ulcers, colitis, and diarrhea. You can also drink the dried Comfrey root and leaves as tea. Today, eating or taking any form of Comfrey by mouth isn't recommended. It's considered unsafe due to the alkaloids that Comfrey contains. These are dangerous chemicals that can cause cancer, severe liver damage, and even death when you consume them. For this reason, the Food and Drug Administration and European countries have banned oral Comfrey products. Very interesting, right? Depends on what side you are on this argument, that it either works really good or it doesn't. It just depends. Do your research, right? Comfrey may be safe to apply to your skin or closed wounds for short periods of time. So again, if it's in an ointment, is that warning on that ointment? If not, then I don't think they really believe what they're saying. What I would submit that some of these places, companies, peoples, whatever, if it works too good, if you ever notice something that works really good, usually don't last very long, right? If you take a drink or you take something and it works really good, somehow it seems to disappear pretty quickly. So there's something up with that, I would suggest. Always talk to your doctor before using products that contain it. They also understand the potential benefits and risks. They may advise you to avoid Comfrey, especially if you're a child, an older adult, pregnant, breastfeeding, someone with a history of the liver disease. So again, just like anything else with any other herb, with anything that we're talking about, usually what we want you to do is check out what you're taking, right? It's just like scriptures and everything else. Go over what's happening. Go over what you need to be a part of, right? It's like going to Sunday church. It's like there's a lot of things there, but it doesn't mean it's always right. There's a lot of things being said, so you have to research, study, and understand what it does. And I hope in most of these cases that you're studying to figure out what you need, right? So all this is to help people, help their bodies, help themselves. That makes sense? But as we find out, it's easier to go to a doctor and tell a doctor that knows nothing about you, that cares nothing about you, but to go tell that doctor what your problem is. And keep in mind, you have to tell that doctor what your problem is because he don't know you and he don't know where it hurts. He don't even know who you are, right? And some doctors don't know the difference between a man or a woman. With all that being said, Surgical wounds can be classified into one of four categories. These categories depend on how contaminated or clean the wound is, the risk of injection, and where the wound is located on the body. Class 1, these are considered clean wounds. They show no signs of infection or inflammation. They often involve the eye, skin, or vascular system. Class 2, what do we have here? These wounds are considered clean, contaminated. Although the wound may not show signs of infection, it has an increased risk of becoming infected because of its location. For example, surgical wounds in the gastroesophageal tract may be at high risk of becoming infected. Class 3, a surgical wound in which an outside object has come into contact with the skin, has a high risk of infection and is considered a contaminated wound. For example, a gunshot wound may be contaminated the skin around where the surgical repair occurs. Class 4, class wound is considered dirty, contaminated. These include wounds that have been exposed to fecal material. So anything like that. Surgical wounds are created when a surgeon makes an incision or a cut with a surgical instrument called the scalpel. A wide variety of medical circumstances require surgery. The size of a wound depends on the type of a procedure and location on the body. Any surgical procedure will create a surgical wound. The likelihood of a wound infection after surgery is between 1 and 3. So this is why we're going over this. If you're having a surgery, had a surgery, know somebody that's having a surgery, then guess what? This can be very helpful. Surgical wounds are frequently monitored to make sure they are healing properly. Infections may affect only the skin, tissue under the skin, or implants. According to the Centers for Disease Control and Prevention, signs of a surgical wound infection include increased pain and redness around the wound, delayed healing, the presence of pus, a foul smell or drainage from the wound. So if you're to that point, you probably need some serious help, right? You probably really need to get something done other than just keep letting it fester and get into serious trouble. In some cases, an infected surgical wound can appear dried out or deeper. Fever may also be a common symptom. So what we see with a lot of times is accompanied with a fever, right? When you have a fever, your body's trying to tell you something. When it's trying to tell you something, you need to listen. And usually, unless you're hard-headed, I guess, you should do the best you can at the first. Because the best remedy, the best thing, just like this, talking about wounds and cuts, scrapes and all that, the better off, the quicker it heals, the better off you are. The less chances of getting something wrong with it, right? Now, this is probably more important the deeper the surgery. A little cut for the average person isn't that big a deal. A cut for a person with diabetes or with some other things starts to get more important. The elderly, young, babies, things of that nature, right? So we have to know what we're dealing with and how to deal with it appropriately. Because if we don't deal with these things appropriately, then they can get worse, right? So if you would, let's come along, and we're trying to do these, trying to have these and do usually a different one every week. And that way we have it, we know what we're talking about, and it's not just like some made up thing, right? The biggest thing really is not, is finding out what it is finding out what you need, finding out what you need to take care of you, if that makes sense, right? Surgical wounds, how are they treated, home care, all these are how to take care of them. But what we're really concerned with is before it gets bad, before it needs something else, right? And this is usually for people who don't want to take pharmacy, people that don't want to take other drugs. But by all means, do your research, know what you're doing, and know what's going on. Because if you don't know what's going on, then what? Then we would just say, what would we say here? I don't know what I'm doing, right? Help me. But that's, again, this is why I believe we come together and we do these things and we help out each other. A lot of this just is surgical wounds and how to deal with wounds and all these type of things, right? But what we really need to do is what? Find out what we need for these wounds and find out what we need to help these wounds. So, moving forward, the outlook for the surgical wound that is properly healing is good. Following infection control recommendations can increase the chances that the wound heals well. So this is what it's all about. If we go back, we go down a little bit more, and a bunch of this again is just to show how deep and how infected and how these things can happen, how the surgery even. And I know people right now that are having multiple problems because of a surgeon and may even lose their leg over this because of the wound didn't heal correctly. Now, is this the magical cure? Maybe not. Maybe so. But the thing that we need to know across the board, I would say, is how to help our body heal, how to help our body and what is in these things. If it's in these ointments, creams, and other things, if we can find the purest form of it, then we need to use that. If not, especially for those people that are just out there, you know, they don't want to go to the doctor, they don't want to go to the hospital, they walk through the woods and scrape their knee or cut their leg open or did something of this nature, they need something usually, right? Because the more that you sweat, the more that you get bugs, the more that all the problems become, is the more problems it becomes with it, right? So we go back one more time and review. This is what it looks like. And this is how, I love the pictures because you know what you're looking at from start to finish. Yes, this is not always what it looks like in the bag, but at least you got a kind of common knowledge of what it should be, or at least the color of it, right? So you got the color of it, you kind of know it's not sand in a bag. It's at least dirt, right? So you're getting somewhere. So again, it is a shrub that grows in parts of Eastern Europe, or Europe and Asia and North America. And a lot of these too, you can grow yourself. A lot of these things, if you can find the seeds for them, you can grow these yourself, which makes it even better because if you're trying to wait for this to come from China, Sri Lanka, India, wherever that you're waiting for it and the time, usually if you got a deep wound, you ain't got time to wait for this to come in for a week or a month or a year, right? And some of these things do take 2 or 3 months going through customs and things of that matter. But if you have them planted, or at least you have the powder or something of them, then you know what you're getting. So the root leaves in the comfrey plant have been used traditionally medicine in many parts of the world. In Japan, the plant has been harvested and used traditionally treatment for over 2,000 years. Again, anything that's been used for 2,000 years probably is good for you. Anything that's been used between 2, 3, 5,000 years, then it's probably a good thing to know about at least, because if not, everybody would have thrown it in the garbage and said, well, forget that, right? It was originally called the knit bone, and people use it to treat muscle sprains, bruises, burns, joint inflammation. And the reason it's called knit bone is because it would actually help your bones. So it's not just for the wound. Again, if you're getting an amputation, like some of these people, the elderly people, are getting their foot or their toes or something like that amputated, removed, then guess what? This not only helps that wound, but it helps the bone. So you might have like bone spurs or your bone trying to grow back, because if you cut that off, bone's going with it. Make sense? So you want that bone to heal back as good as possible too, because if the bone doesn't heal back, then the flesh is not going to heal back right. And then it's going to be a problem. And if that doesn't work out, then it goes up further. It goes, that's why you see people lose 1 toe, 3 toes, 5 toes, their foot, their ankle, and then their leg, because it's just slowly but surely deteriorating. So hopefully people could use something like this, right? So hopefully this is something that can be used and people will use to help these things. And again, whether it's something simple as cutting a finger or something as, as important that you are being amputated, that check into it and do your research. Make sure that this is something for you, because again, it could be for a mosquito bite, a bug bite, chiggers, anything that produces a wound or a problem, and ticks, all these other things that become a problem. The main thing with any of these, and the older and the diabetic, the more the bigger problem, right? So you want to, whether you say nip it in the bud, right? So you want to get it to where you are taking care of yourself as much as possible. And that way, there's nobody to blame but you, right? But especially when it's something small, and again, it's mainly for a lot of people that just don't want to go to the doctors. They don't want to go and deal with all that. They want their home remedies and this type of thing, because we're not in any way insinuating don't go to the hospital, don't go to the doctor. If you're bleeding to death, you're having problems, then by all means, make sure you take care of your body and you take care of yourself. But again, this is for those minor scrapes to the biggest wounds. We'll do one more and then we'll close it up. The roots of the leaves of the comfrey plant contain the chemical substance called allantoin and rosmarinic acid. The allantoin boosts the growth of new skin cells, while the rosmarinic acid, let me go here a little bit, helps relieve the pain and inflammation. Extracts are still made from the roots and leaves and turned into ointments, creams, and salves. So if you look around, you'll probably see this in some of those ointments, some of those salves, some of these things that you can get off the counter, and some that you have to get a actual script for, right? You have to go with some of these for some reason. Allylic acid, to the best of my knowledge, is blackberries, raspberries, and it's just berries. But to get it in the United States, in certain states, you have to have a prescription for it. Why? You tell me. But, some of these things are just, they are what they are. But the reason that you can have this is Yahweh made it, so all this is to bring ourselves back to the ancient ways, to what we see happen before we had big hospitals, big doctors. Doctors used to come to the house, they used to care, but anymore it's kind of like, if your insurance is good, they'll give you anything. If not, they won't give you nothing. So with all those lines in between, I just want to thank you for showing up and for listening. And until next time, may Yahweh bless you Again, we try to do this every week, so please join us and